Hello everyone. Today we'll discuss the topic 4.4, that is ECG, electrocardiogram. That is a long form of ECG, or it is also called as electrocardiograph. Then what does it means? This ECG is nothing but what? The electrical events occurring during a cardiac cycle. What are these are the certain waves. These are the P wave. Then next one is a downward deflected Q wave. Then R wave. Then S wave. Then the T wave. These are all the waves. And these waves occur in between the segments. That is the what? These ST segments or like that. Then these are the electric events of the cardiac cycle or ECG. The first, this auricle starts to contract. When the waves of contraction in the auricle starts, that causes the depolarization of the auricular muscles, and that results there is a start of the auricular contraction, and at this moment there is a complete auricular contraction. You can note the what, this magenta color structure, and this is the start of the auricular depolarization. This is complete auricular depolarization or the contraction. Depolarization occurs during contraction and repolarization occurs during the relaxation. This means that this is a upward deflection, that is called as a P wave, and this P wave indicates the auricular depolarization. After auricular depolarization, what happens? The contraction or waves of the contraction, it moves towards the this AV node, and from AV node it goes to the what? The bundle of His and Purkinje fiber. These are the what? This during the Q wave. This Q wave is somewhat downward deflection, and during that, what happens? The this event, that is a ventricular contraction, starts, and this is a downward direction. And when it passes towards the Purkinje fibers, then the upward deflection occurs, and that is called as a R wave. And when again the what? These Purkinje fiber, or the when this Purkinje fiber conducts the impulse of the contraction, then all the ventricles starts to contract. And when these starts to contract during the isovolumetric contraction, what happens? This is a downward deflection of the R wave. And when there is a complete depolarization, there is a next wave, that is called as a S wave, which is a downward and small downward and then upward deflection. This is a upward deflection, that is a this F wave, S wave. Means when this P wave indicates the auricular depolarization, then next the ventricular depolarization starts from these, that is from the Q wave, then Q wave, then next that is a R wave, and it ends at the S wave. And this entire depolarization of the what? The ventricle, it is indicated by the QRS complex. Means QRS complex, it indicates the ventricular contraction. After ventricular contraction, the next thing, that is a what? Relaxation of the ventricle. And this relaxation means waves of the contraction. After the waves of contraction, or the after this QRS complex, these ventricles get relaxed, and that is indicated by the upward deflection of the wave, and that we called it as a T wave. Means this T wave indicates the repolarization of the what? The ventricles. Means in this P wave indicates the depolarization of auricles, then QRS complex indicates the ventricular contraction, and the T wave, it indicates the repolarization of the ventricles. The graph paper recording produced by the machine is termed as the electrocardiogram, or it is electrocardiogram. It is usually called as a ECG, or it is also called as a EKG. And here the word, this is a reference pulse. One large 5 mm into 5 mm box, it represents the 0.2 seconds. Means this box, it represents the 0.2 seconds. Means within a what, such boxes, that is the 4 boxes will be there to complete the what, the complete beat, that is a 0.8 seconds. One last square, that is a 1 large square is equal to 0.2 second, and one small square, this is a one small square, it indicates the 0.04 seconds. So this is how the graph is recorded. And means when this complete, that is from P wave to the what, from P wave up to the next, that is a T wave, there will be the these 4 squares. Then this is a normal size or the normal electrocardiogram, that is this is a P wave, and in between this P and the what, this is a PR interval, this is a PR segment, and 3 to 5 small squares are there in the what, this P wave. When the QRS complex, this is a QRS complex, and up to this, from this Q to what, this T, it is represented by the 2 large squares. That is here the 2 small square in between the ST segment. This P wave indicates the depolarization of the auricle. Then this QRS complex indicates the ventricular depolarization, and the upward deflecting wave, that is a T wave, it represents the ventricular repolarization or ventricular relaxation. This is the how the what is the meaning of this in this P wave. It indicates the auricular depolarization, which starts from the SA node to the AV node, and it up to the AV node. Then next thing is a what, this QRS complex, that indicates the depolarization of ventricles, and after that this is a T wave, which indicates the repolarization of the ventricle. Then in between all these waves there are the segments. This one is about the PR interval. This time for electrical impulse take to travel from SA node through AV node and entering into the ventricles. Then what is a PR segment? Electrical conduction from AV node to the bundle of His, to the bundle of branches, and then to the Purkinje fiber, that we called it as a what? The PR segment. Then this QRS complex indicates the depolarization of ventricles, and this ST segment, it indicates the depolarization of ventricle, which is a isoelectric. And this QT interval. What is this QT interval? It indicates a it indicates the a prolonged QT interval is a risk factor for ventricular tachyarrhythmiasis and sudden death, and therefore this is indicated by the what, 2 large squares. Then the best way to interpret an ECG is to do it step by step. That are the rhythm, then cardiac axis, rate, P wave, QR, PR interval, QRS complex, ST segment, and this QT interval. The first we'll discuss the rate. As a general interpretation, this rate of this, it is indicated by 300 divided by the number of big square between R interval, or rate is equal to 1500 divided by number of small squares between R interval. These are the 15 small squares or in between the two R. This is a what? This QRS complex. Okay. And this is a P wave and this one is a T wave. This these in between two R, there are the three big squares and therefore rate is equal to 300 divided by 3, that equal to 100 beats per minute, or rate is equal to 1500 divided by the 15 small square. These are the 15 small square, that is the rate. Then the rhythm. These P waves and their relationship to the QRS complex. The if this is the rhythm, or how the what the activity or this ECG is the rhythmic movement. It will repeat after the each, that is all the events will be repeated after the 0.8 seconds. The measure ventricular rhythm by measuring the RR interval and atrial rhythm by measuring between the PP interval. This is the what you are measuring, the what the rhythm. This rhythm is completed means each R that is indicated, or the rhythm, it is shown by the what, this 1 2 3 and 4. This 4 indicates the 0.8 second. 4 big square indicate the 0.8 second. Then again 1 2 3 and 4 means this cycle or the ECG, it is repeated every 0.8 second. Then the next is the P wave. This P wave or the normal P wave indicates the three small squares wide. These are the in large big square, there are the how many squares? 1, 2, 3 and 5 squares. This P wave indicates the 3 normal square wide and 2.5 small square high. This is the 3 squares wide and 2.5 small square high, always positive in lead 1 and 2, and commonly biphasic. Then the this is the next is the PR interval, that is indicated by 3 to 5 small squares. That is means PR interval, it lasts for the 0.2 seconds. Long PR interval may indicate the heart block, and short PR interval may this is like cause the disease like old Parkinson's disease. Then the PR interval. This PR interval, it is indicated by the 5 small square. Just we have discussed that 5 small squares means how much time? That is 0.2 seconds. This P wave precedes the QRX complex, but PR interval prolongs and remain constant from bit to bit. Then QRS complex. This is the Q wave and this is the Q downward direction Q wave, then R wave, and this is the S. This QRS complex, that is three small squares prolonged, QRS complex indicates the hyperkalemia or bundle branch block, and it is indicated by how many squares? That is a three small squares, and it is in its duration is 0.06 to 0.10 second. This Q wave amplitude is less than 1/3 QRS amplitude, and this is the what the QRS or the normal QRS complex. Increased QRS complex or increased amplitude indicates the cardiac hypertrophy. Then ST segments. These ST segments, it is indicated by 2 to 3 small squares, and the ST segment is isoelectric at the same level as subsequent PR interval. Then Qt interval. This is a large Q interval that is from Q to T, and it is represented by two large squares, means that is what, 0.4 second, means the cardiac, out of this cardiac cycle, it is of 0.8 second. Out of that half duration, it is indicated by the this Qt complex. Then this Qt complex or the interval, sorry, this is Qt interval, it decreases when heart rate increases. For every BPM, 10 BPM increases with the what? 70 subtract 0.02 second.